Good afternoon, everyone. Thank you so much for joining our webinar. We will just give a couple minutes for some more people to filter in, and then we'll go ahead and get started. All right, so I think a number of people have joined us, so we can go ahead and start. So good afternoon or good morning or good evening to everyone from wherever you're joining from. And we thank you so much for joining today's event. My name is Beatrice Zovich, and I'm a public health program manager at the Hepatitis B Foundation. The focus of today's webinar will be Learn the Link, which is highlighting the connection between hepatitis B and liver cancer. I will begin by providing a brief introduction of the project that we've led over the past few years to raise awareness about the connection between hepatitis B and liver cancer in a culturally relevant way. And we'll present the materials that we've created for that purpose. And then I will invite our panelists to participate in a discussion about their various experiences in assisting with the assembly of the project to various degrees and respond to some questions about this. And I'll also invite panelists to share a little bit about their own work in closing disparities in hepatitis B and liver cancer knowledge and screening rates in their communities. So we hope that this webinar will increase awareness and uptake of the new communications campaign that we're presenting today, which is tailored for multiple different communities across the United States. And we thank you all very much again for joining today. Next slide, please. Thank you so much. So before we get started, I would just like to remind all participants that during today's webinar, all audience members are muted. We encourage you to use the chat feature to let us know who you are and where you're joining from. If you do have any technical challenges, please feel free to indicate your issue using the chat box and we'll address it as soon as possible. And if at any time during the presentation you have questions for any of our panelists, you can feel free to enter them into the Q&A box. We will address all questions at the conclusion of the panel discussion. And the session is also being recorded, and the recording will be sent out to all registrants following today's session. Next slide, please. Thank you. So first, we'll start by just sharing a link to the materials that we have created for this project. So Holly, if you actually wouldn't mind to stop sharing for just 1 second. And I'm going to put the link to the materials in the chat and just share my screen briefly so that everyone can kind of see what the materials look like. So just give me 1 second. Okay. All right, so you can see on the screen here, this is the website where we have compiled materials for 12 different communities, which are all listed here. You can see a little bit of background about the project, which I'll also present momentarily. And just an example of what one of the communities looks like. They're all fairly similar, but for the Cantonese community, you can see that we have a variety of infographics, flyers, fact sheets, takeaway cards, and then a number of different social media graphics and images to be used at the bottom, covering many different aspects of hepatitis B and liver cancer, including testing, transmission, symptoms, prevention, and then a basic introduction to the two diseases and the link between them. And each community also has a social media toolkit at the bottom with suggested captions. So all of these images are downloadable, and you can, if you'd like captions to put with them to put on your own social media, they are available through any of these toolkits. So that's just to kind of, this is what a toolkit looks like. So that's just to kind of give an overview of the campaign and what it looks like. So I'm going to stop sharing for just a second. And then just in order to make this presentation a little more interactive, we wanted to do a couple of audience polls before we get started. So I am going to launch our first poll. So we encourage you all to participate if you are able. So the poll has 4 questions. So we would love for you to answer these as you're able. So it's just asking who has already seen the materials, if anyone, if you're part of any of the communities that are highly impacted by hepatitis B and liver cancer, what types of materials are most helpful to your community, and just a quick question about general hepatitis B knowledge. So please feel free to complete the poll if you can. And I'll just give a couple of minutes for folks to do so. Yep. Um, Welcome. Thank you so much to everyone for joining. We'll see if anyone is able to complete the poll. We encourage you to do so. It should show up on your screen, and it just allows us to have a little more interaction. So you can let us know if you've seen the materials before, and if you're a member of any communities that are highly impacted by hepatitis B and liver cancer. Okay. Yep. Okay, so that's okay. I think we didn't get too many responses, but that's no problem. So hopefully after today's webinar, we'll be more familiar with the materials and able to interact with them. So I think if we can go ahead and share the slides one more time, please. Thank you so much. So we can move forward to the next slide. So just to start off with giving a little bit of background about this. Oh, okay. So I think the poll may not have been shared. Let me try to just share it one more time. I'm sorry. Okay, I apologize for that. I'm not sure exactly what happened with the poll, so I'm sorry for the technical difficulties. But hopefully we can discuss a little more in the presentation at the end, and we can share a little bit more. Basically, it was just asking if you'd seen the materials previously, and kind of were a member of the communities who were impacted. So we'll go over sort of some of the most impacted communities and have a little more discussion at the end. So my apologies for that. But without further ado, we can just kind of get into the project a little more. So first, just to provide a little bit of background. So about, and just kind of how this project got started. So as some of you may know, there are up to 2.4 million people in the US who are living with chronic hepatitis B infection, and this tends to impact communities born outside of the United States more, particularly those from Asia, the Pacific Islands, the Caribbean, and Sub-Saharan Africa. And individuals who are living with unmanaged hepatitis B have a 15 to 30% lifetime risk of dying prematurely from cirrhosis or liver cancer. And there are several factors that contribute to this, most notably low awareness, cultural norms, and a lot of misperceptions that can play into low rates of screening and care rates for different communities. So the objectives of this project were to try to better understand existing knowledge and perceptions about hepatitis B and its relationship to liver cancer in some communities that are at highest risk for both of the diseases, and to use the findings to develop and employ effective communication strategies that can help to raise awareness and dispel some of these myths. Next slide, please. So in order to accomplish this, we assembled a total of 15 different focus groups and 2 key informant interviews with community members, community leaders, and public health experts throughout the United States. And these were conducted to assess beliefs and attitudes about hepatitis B and liver cancer and to identify useful communication strategies for each community. So you can see the different communities that are listed here on the slide. There are 12 in total. And we also convened an advisory committee in order to provide guidance on holding the focus groups and creating the interview guides and recruitment materials and the initial outline of the communications campaign. And so the input that we got from these different groups was really used to inform the campaign that we just showed you. Next slide, please. So all of this has led to us launching this campaign for Cancer Awareness Month in February this year. And we're very excited to have the campaign available, and we look forward to speaking with our panelists in more detail about their experiences in assisting with the project and their ideas for the type of impact that this campaign can have on different communities in terms of raising awareness about the connection between hepatitis B and liver cancer, and encouraging uptake of screening and prevention in particular. Next slide, please. Thank you. So to get started, I will now introduce our panelists so that we can talk more in depth about specific parts of the project with which different people were directly involved in different ways, and how everyone helped to kind of move the project forward in some way. So we don't have all of these people joining us today, but I will introduce those who we do have. So we're very excited to be joined by Pharma Penne, who is a project coordinator at the Viral Hepatitis Program at the New York City Department of Health and Mental Hygiene, and served as a member of the advisory committee for this project. We're also joined by Serena Cao and Ariana Hung, who are co-chairs of Team HBV high school chapter in California. And we are also joined by Azeb Yousef, who is joining us, or who's associated with the Columbus Department of Health, and who is joining us today all the way from Ethiopia. So thank you so much for being here with us. And Dr. Tran and Rensley and SB may join us as the time goes on. So thank you all so much for being here. So I think we can stop sharing the slides for just a little bit, and we can launch into our panel discussion. So we welcome everyone today, and we'll start with a few selected questions to sort of guide the conversation about these materials. And just a reminder to the audience, if anyone has any questions, please feel free to type them into the Q&A box, and we'll do our best to get them answered. So we can start off with just having everybody introduce yourself, and if you wouldn't mind just sharing a little bit about how your work relates to hepatitis B and or liver cancer. And I will start with Pharma, if you wouldn't mind sharing, please.
Sure. Hello. So my name is Pharma Penne. I am from West Africa, Senegal, and I am the Checkaby project coordinator for the Department of Health Viral Hepatitis Program, as well as the CHIPO NYC lead, which is the NYC chapter of CHIPO National. So both in the Checkaby and CHIPO NYC, we have partnership with sites who are community-based organizations and health centers who we work with, and they all centered, their work is centered around Hep B outreach, education, screening, vaccination, and linkage to care. So our partners are centered in the community, they speak the language, they provide culturally competent outreach and services. And I know some of them are here, so I just wanted to take the opportunity to say thank you so much for the hard work and for the impact you have in the community.
Wonderful. Thank you so much, Pharma. And thank you everyone who's able to join us today as well. Serena, would you like to share a little bit about your work in the hepatitis B space?
Yeah, of course. Thank you, Beatrice, first of all, for having us. I'm Serena, and I'm a current high school senior, and I'm one of the co-chairs this year at Team HBV. And we're this youth chapter international organization that has chapters at different high schools throughout the world. And this is part of the Stanford Asian Liver Center. And we really just work on spreading initiatives, raising awareness, working with the Asian Liver Center to host events such as our youth leadership conference every year, to promote prevention efforts and just awareness among the younger generation. So we all know the importance of prevention and testing for hepatitis B.
Great. Thank you so much, Serena. Ariana, would you like to share, just introduce yourself briefly as well?
Yes, thank you so much for having me. My name is Ariana, and I'm currently a senior in California. And my journey with hepatitis B and liver cancer awareness actually began in around 2018 when I first joined like the hashtag Join Jade campaign. And since then, I've been very deeply involved with Team HBV. And what we do is just basically what Serena talked about, just handling different chapters internationally. We've recently started our Cambodia Society, which we are very happy to have. And through fundraising, community events, and educational outreach, we aim to like raise awareness for hepatitis B and liver cancer.
Awesome. Thank you so much, you guys, for joining and for your great work. Dr. Tran, thank you so much for being here. Really appreciate it. Would you like to briefly introduce yourself?
Okay, thank you. Been Tran, we have worked with hepatitis B for a long time in different capacities. Since 2001, we did the screenings, and later on we progressed into more on the education part. And most recently, we have a community education mapping application where we build upon the train the trainer model, where certified trainers teach back to others within their respective communities. And this app is a medium through which trainers can become certified and create a profile to track their direct and indirect trainees. This program can be geared towards many disease studies, but for right now, we focus on hepatitis B. Thank you.
Wonderful. Thank you so much. If you have the link for the app, actually, and you'd like to either put it in the chat or share it with me, we can share it with the audience after the webinar. But thank you so much. Azab, are you able to unmute to introduce yourself? Thank you so much for joining me.
Absolutely. Just a few correction. My name is Azib Yusuf, and I establish multicultural strategies for health. I reside in Houston, Texas. Currently, I'm visiting Ethiopia regarding hepatitis B and cancer that have been serving greater Houston community, especially immigrant and refugees, access to healthcare. Mostly we see breast cancer, prostate cancer, or liver cancer. And sometimes hepatitis B is not noticed till we go and get checked at the clinics or FQHCs. So I was really driven by this because people are not really paying attention, nor they really don't speak the language to access the complex US healthcare system. For us, it might be easy, but they are Houston being very diverse. It's not only Spanish or it's not only Ethiopian language. You have languages from all over the world. So we try our best to educate, inform, as well as be their advocates so that they can get the access that they need. Currently, I'm in Ethiopia and focusing also on hepatitis B and liver cancer to see what are the difficulties that they face so that I can have an opportunity for them to secure grants, maybe from US, create that partnership. I'll be visiting different hospitals, sites, nonprofit organization, so that we can support them the best way that we know. And thank you.
Great. Thank you so much. And thank you for joining all the way from Ethiopia and sharing your great work from Houston as well. It's always good to have partners in different parts of the country. Great. Well, thank you all very much again for being here. So next, maybe if we could talk a little bit about why providing education and awareness about specifically the connection between hepatitis B and liver cancer is important for your particular community. Some of you touched on this a little bit briefly, but if anyone, we have a few different communities represented here today. So if anyone wants to, just one or two folks want to share about why highlighting this connection is crucial, that would be great.
I can go. I think a lot of many people here know that West Africa has the highest rates of HCC, which is hepatocellular carcinoma, which is highest in sub-Saharan Africa. And according to the AASLD guideline, anyone with chronic hepatitis B who is African-born should get screened for liver cancer at as early as 20 years of age. And I really think that education awareness are crucial for patients and providers. I think that providers need to be the first in line of defense in making sure that patients are being screened for liver cancer. And patients must also be informed in order to advocate for themselves in the event that screening is not being offered. Overall, given that liver cancer is very high in our community, I think it's really important just making sure that patients are aware of these and taking the right step to being screened at least every 6 months. So,
yeah, absolutely. Thank you so much. Yeah, and I know especially having rates of, particularly younger people, especially being impacted by liver cancer at younger ages makes raising the awareness especially important. Does anyone else want to share briefly about why emphasizing this connection is so important in your particular community?
Yeah, I think especially in the Asian community as well, which is where hepatitis B is pretty prevalent. I feel like there's a lot of stigma and stereotypes about people with the hepatitis B, disease. And I think by providing like education and awareness, we can empower the individuals to actually make informed decisions about their health instead of not getting tested just because of some stigma associated with the disease, and to encourage them to like seek testing and vaccination if necessary. So yeah, I think what we're doing is really impactful because it can really save a lot of lives.
Yeah, absolutely. Thank you so much for sharing. I see that we have been joined by Rensley. I'm so happy to see you. Thank you for joining. Would you like to just briefly introduce yourself? Rensley is joining us from Hawaii.
Actually, I was in since the beginning, but I think my name was not shown, so I just changed.
Oh, okay. I'm sorry. Thank you.
Yeah. Yeah, my name is Rensley Alik. I'm the co-founder of Micronesian Education for Liver Wellness Program. We work alongside with Free Hawaii. We started since 2015. We do session via in person or Zoom with individuals, families, community organizations such as sports and churches. And we're happy to be part of this talk this morning here in Hawaii.
Wonderful.
Thank you
so much. Would you like to share just a little bit about why emphasizing the connection between hepatitis B and liver cancer specifically is so important to the Micronesian community?
Yes, as you may all know, we have the highest rate of hepatitis B here in Micronesia, or particularly Marshallese Chukis that we work along with. When we have our session with them, we realize that they don't understand the link between hepatitis B and liver cancer. So the screening, when they do screening, they just, oh, I have hepatitis B, but they don't know that down the road they can have liver cancer. So we explain, whenever we do our session, we always include liver cancer as part of our discussion so that they can understand, because it's very important.
Absolutely. Thank you so much. So to shift focus a little bit, so we know that I think we heard a little bit about stigma that, can be persistent in both of these diseases in various communities. And this can often be related to specific sort of myths or misconceptions that might exist around hepatitis B and or liver cancer, either separately or together. So are there any sort of these types of myths or perhaps misinformation that perhaps these materials might be able to address for your community, or that are particularly persistent that you hope can be overcome?
I think I can go.
Of course.
Yeah, especially the Vietnamese people who are not very science savvy. They go with herbal meds, and sometimes they use like vegetables. Some people use the silk on the corn ears. At one time I went to groceries and I saw people picking up all those parts of the corn, saying that I will use it to treat my disease. So those are misconceptions that really need to be eradicated or addressed.
Yeah, absolutely. I think that's when we see pretty frequently alternative remedies for hepatitis B, and also ideas about transmission through food as well is something that can come up. Do others have thoughts
I can
about?
go.
Yeah, feel free.
Yeah, I agree with Doctor about medicine, using the traditional medicine over Western medicine. That's one of the challenge we have. One of the challenges we have here in with our community, Micronesian community, and also I would say screening. We have this mentality that if we get sick, that's when we go for screening. So we're trying to encourage, especially men, because they tend not to have their annual checkup or anything. They delay because they feel strong. So we encourage them to not wait, because when you have hepatitis, you may have it for 25 years down the road, and then later on you just down the hill and never go up again. So screening, that's one of the challenges we face here in our community. Thank you.
Absolutely.
I just want to
Yeah.
add, because I think that hepatitis B remains a relatively unknown disease in our community. And when family members is diagnosed, the news is frequently kept secret and not discussed. Patients sometimes describe hepatitis B as a genetic disorder compared to diabetes or HIV. Others believe that those infected with hepatitis B can get married or have kids. And I definitely think that these materials, and once they are available in other languages, will significantly contribute to re-education, improve discussion, and support among families. So I think it's gonna help a lot. So looking forward to the access or the availability that it will have in the community to produce a lot of the misconceptions.
Yes, absolutely. Thank you so much for sharing. Yeah, I know the impact on quality of life was definitely a big theme that arose from the focus groups that we did, and also accessing medicine and medical services when it's not an emergency, and someone might not show symptoms for years or even decades. So there might be less of a sense of urgency. So yeah, thank you so much for sharing all of that. And then what do you kind of see as some of the biggest barriers or challenges for addressing specifically hepatitis B screening and prevention in your community? And then if there are any, if the barriers are similar or different for addressing liver cancer, and how do you think that these might be able to be addressed?
I can start with.
Go ahead.
Okay. So I think for us in California, there was this law that was just passed last year, and it was led actually by the founder of the Stanford Asian Liver Center, Dr. Samuel So. He was led in this initiative to pass a hepatitis screening law in California. Basically, it offers all adults in California to be able to get a free testing for hepatitis B and C at their primary care. And we really think that this is something that we've been trying to spread awareness to all of our high schools and chapters across the country that may not be in California, and to really push for this policy change. I think this is a great way to kind of bridge that public health disparity between the cost of testing and just really making that accessible to everyone. And I think adding on to that, really, hepatitis B is a very preventable illness, I think, if we screen early enough and if we vaccinate instead of like kind of playing catch up later on, like we're trying to treat it when we can kind of prevent it in the first place.
Absolutely. Yeah, I think that was a huge policy win for California for sure. And I think having it implemented will really go a long way, and hopefully other states can follow suit. It was very important.
Yeah, Dr.
Yeah,
Gish, Dr.
course.
Gish from San Diego also has a motto that we should test all the patients who are triple test negative. So we should vaccinate them, and people who are positive for antibody, we should treat them.
Mhm. Yeah, absolutely. It's really important to, I know Pharma had mentioned before ASLD guidelines, and they can, different, there's kind of different sets of guidelines that I think people follow, which, having those be more streamlined and widely used would really go a long way as well. Any others thoughts on particular ways to increase or address screening disparities for hepatitis B or liver cancer, separately or together?
I think I'm going to go this time.
Yeah, of course.
One other thing that we have in Houston, Texas, we do have federally qualified health centers. When they come in, they do not only hepatitis B, they also do HIV and STI testing. But sometimes the length of the time that takes for one, because the line is so long, people are not, they're not impatient, so they just leave. On the other hand, we don't have a specific provider who focuses on hepatitis B to do the testing. And then on the other hand, additionally, we do have educational seminars. Sometimes they're too long and too boring. People really tend to fall asleep.
Yes.
Because the medical terminology is very complex for their knowledge, and you can see people are getting fatigued, agitated. They will get up and get water, coffee to let it go. 20 pages of PowerPoint presentation, it does not help. People like really short, maybe 10 pages of PowerPoint presentation, in between some fun activity, some prizing. And then one thing I really like is to have providers come into those when we do events. That way people will get some small tokens, small giveaways that will make them comfortable to continue. So it's not only giving education, it really is communicating with people one-on-one interaction that helps the most.
Yes, absolutely. I think that's a really important point. Hepatitis B can definitely be a very complex disease, and hard, just hard to understand. And it's a definitely important point for keeping materials brief and to the point and engaging as possible. So thank you so much for that. I just want. Oh, sorry. Yes,
I
go
just
ahead.
wanted to add, because this came up in one of our GPNYC meeting, which we recently had, and one of the issue is that because patients don't have the liver cancer screening on the same day as the Hep B appointment with providers, they often miss the liver cancer screening. So I'm not sure if there's any way, but I think it's very important, if possible, to make sure that liver cancer screening and their Hep B appointment happens on the same day, because most people are working and you have to take a day off, and requesting too many days off may look bad, with whatever organization you work with. So if possible, I think having both appointments on the same day will really help improve, liver cancer screening, as well as, the attendance for their Hep B appointments with providers.
Absolutely. Yeah. And I think that, really speaks to, the kind of quality of life issues as well, and people not having the time or capacity to attend multiple appointments, or perhaps the transportation or childcare, multiple other factors. So I think that that's definitely a really important point. Thank you so much. SB, thank you so much for joining. It's lovely to see you. Would you like to just introduce yourself? I think you're muted, but we'd love to just hear where you're joining from.
Okay. Yeah, do you hear me now?
Yes.
Yeah,
Thank
okay.
you.
Yeah, I'm 82 years old, and I'm living with hepatitis B. I learned it through how to get the therapy and all that work from the Hepatitis B Foundation. So I'm very grateful for it. Yeah, yeah, you can live a normal life, and I feel I live a very healthy life with Hep B.
Absolutely. And do you have any thoughts on sort of, so you are representing the Filipino community. Do you have ideas for what are some of the biggest challenges for hepatitis B and liver cancer screening in your community, and how to best address them?
Yes, I think there's some stigma to it. You cannot kind of disclose it to everyone you meet because of a lack of education on their part. They think it's just you can contaminate them. So that's one thing. And I believe the program that we're doing of bringing out the awareness is very important. And it's not a death sentence. Let me put it that way. It's not a death sentence. It's manageable, and you can lead a very normal life. I swim every other day. I dance. I play pickleball, and I just take my family. That's all, and get my 6 months follow up, and everything. Thank God, not good. Everything seems to be okay.
Wonderful. Yes, thank you so much. Yeah, I think, emphasizing that your whole life doesn't have to change, and that is just a manageable condition, I think is really, really important. So thank you so much for sharing and for joining us today. So just a couple more questions, prepared questions, and then we'll move into some from the audience. And thank you everyone who introduced yourself in the chat. We have a lot of people, I think, joining us from many different parts of the world. So thank you so much for being here. So for the panelists, what are some of the most effective tools that you found for communicating about both the link between hepatitis B and liver cancer, and also just about health issues in general in your community? What do you find to be the most effective? And how does having materials that are kind of culturally relevant and tailored for specific communities increase their acceptability and encourage people to take their messages?
I can go.
Yeah.
Thank you. We found that having the patients tell their stories is very efficient. Like the lady before has said so, and because people will relate much more. How come that person is like me, and then they got it through. That's very good.
Yeah, absolutely. Having community partners, I think is so important. Absolutely.
I believe,
yeah.
Go ahead.
Yeah,
I believe
go
one
ahead.
of the most effective way that I have seen throughout my work is creating beautiful T-shirts with colors and then language the community speaks. That really, really helps take the message out. People love to post it on their social media. They circulated on their WhatsApp groups, Instagram, Facebook. That really helps. And people intend to wear the t-shirt, not only for adults, we also make t-shirts for the kids. And that's very successful.
That's awesome. I love that idea. Thank you so much. Maybe one more person wants to share.
I'd like to
Go ahead.
contribute something. I think the storytelling program was very effective because it make you realize it's not only you, and there's so many ways to deal with it. And sharing their experiences, I think, is effective because it's not only me, and there's some support and what have you, and learning more from other people.
Absolutely. Yeah, I think feeling alone and isolation can be two of the hardest things about hepatitis B. So certainly building a community in that way is very crucial. So thank you so much.
Can I just add one?
Yeah, of course. Feel free.
When we do our session, we usually prepare some snacks or something that people will come and munch on while we do our education. We usually have a small store that they serve coffee. So we just put like $50 and then we have them drink coffee out of that. So we have a lot of participants come out just to join because they like to drink coffee, but at the same time they listen to our presentation. Just
That's
incentive.
wonderful.
Yeah.
Yes. Yeah, I think that's so crucial. Absolutely. And that helps to build community as well. So it's people can kind of, get to know each other and also have that aspect as well as learning and an education session. Wonderful. So I think to kind of wrap up this particular portion, I'll kind of combine the last sort of two questions that I have. So we kind of touched on this before, but right now all of the materials are still in English, but translating them is the next step for us. So I'm just kind of curious how you think having materials available in audiences' native languages will play a role in the effectiveness of the campaign. And also, in addition to translating the materials, some of the also next steps. So right now, what we mainly have available are printed materials and digital. So for social media and flyers, et cetera. But some other ideas that we have include doing things like paid media outlets. So radio messaging, newspaper ads, YouTube videos, things like that. So I'm just curious if any of these you think would be effective tools for also reaching out to your communities and conveying this information.
I can go.
Yeah.
Thank you.
Sure.
Okay. In Vietnamese, people will understand much better. So we will have them translate into Vietnamese. And about the medium, being able to put in videos will be wonderful, because like on YouTube, people watch cooking recipes and they are glued to the screen. What about inserting some messages for our group? They will catch the warning. Thank you.
Absolutely. That's a great idea. Yeah.
So to the first question, I think that having the right approach and culturally competent messages can increase acceptability. And I believe that the strategies you mentioned can be effective in ensuring that these resources are distributed to the appropriate target population, including the African-born population. But I also think that it's important to consider other platforms such as WhatsApp, Facebook, because they are widely used in my community and can serve as a potential avenues for combating misinformation. I think other channels such as using YouTube Shorts or TikTok can help reach more audiences as well.
Absolutely. Those are great suggestions. I know WhatsApp is very commonly used throughout multiple communities, so that's very important as well. Any other thoughts on ideas for other sorts of platforms?
I think one of the things, I'm sorry.
No, go ahead.
One of the things that we do is artwork, especially with, for example, we work with the Afghani children who truly does amazing artwork. And then if we can do a contest, like giving the kids, teaching them and draw something for us and how they feel about it. So the artwork is amazing. So if we can do that in school contests and then give them a prize, the first winner gets this, the school will be happy to do projects like that. That way we educate not only the kids, the parents, and then also the principals. I think it would be great.
Yes, that is a fantastic idea. Thank you so much. And yeah, it's such great creativity. So that's fantastic. SB, did you have your hand up or want to share about any of these channels? If not, that's okay. I just wasn't sure. Nope.
Yeah, just a comment on those artwork. One year, we got a lot of calendars. They printed on that, and that is easy to distribute at health fairs and so on, especially closer to the beginning of the year. So, and on the calendar, you can highlight all the things you want to teach about hepatitis B and liver cancer.
Yeah,
that's a
you want me
fantastic
to
idea.
continue?
Yes, go ahead. I'm sorry.
Yeah. My point is making communication in the local language is very important. That means you are connecting with them. That means you're understanding their situation, or the fact that you can communicate in a language is already a big winner, because hey, you understand what you're going to their level, that level of communication. So that is very, and I still find that the storytelling is very important. We share things, not only about hepatitis B, anything in the world. You say, oh, I experienced this and that. And to me, the experience is the best teacher than doctors. I'm not saying downsizing the doctors, but it is more from the local people on the same level. They can relate to it better.
Yes, 100%. Thank you so much. Those great insights. So any kind of last thoughts before there's a few questions from the audience, but is there any last thought that anyone wants to share about this campaign or the importance of it before we address some audience questions?
One more, I think we should involve our local artists like musicians. They do really like to do community service if they can make music for the young ones, and then we can get more older generation as well to perform. This is really a great tool. People love to go out and listen and enjoy in the community. So we do have community leaders and we do have singers in our community that we utilize.
That is awesome. Yeah, such great creative routes to kind of engage people and draw on existing strengths. So that is very cool. All right, so I think we have a couple of questions in the question box. So let's see here. Oh, okay. So can you share more about what you learned about messages that were particularly motivating or resonant related to vaccination? So I think in terms of I'll open that up to anyone who has any thoughts about what resonates particularly with your own communities about vaccination, and then I can share some of the findings that we had related to this.
Well, I guess vaccination is the preventive thing.
Mm-hmm.
Yeah. And I think education, I mean, being awareness, what are the advantages of having vaccinated? You prevent, in effect, you prevent contamination, don't you? And there's a lot of lack of awareness there, and how important it is. I think basing on what my experience was when I found out I had it, that I didn't realize that my family got to be vaccinated, my spouse, my son, and what have you. Now, understanding that, it gave me a feeling of security and prevention. They're not probably gonna get it, and periodically still follow it up at certain times, because it could change sometimes. And so that was, to me, that was very important. So I think the vaccination, it seems to me nowadays at birth, the babies are being vaccinated. So that is a preventive thing. The one that doesn't seem to be as aware are spouses, or any relationship that you have, that, they could possibly get it through the other means of birth.
Yeah, absolutely.
To add, in the past, while working with patients who are diagnosed with hepatitis B, often they wanted their family member to be tested, to be vaccinated, but they didn't want to bring up the message because, they were already diagnosed with chronic Hep B, and because there was a lot of stigma associated with it, they didn't know how to bring it to their family. And so I always had to call and say, "Hello, I'm from the health department. I am also from West Africa, and hepatitis is prevalent in our community. I'm calling just to make sure that people from our community are being tested and vaccinated for hepatitis B to prevent a possible transmission." And so that was a what I used to use in order to encourage testing and vaccination. But often, it's always without a lot of the education around it. People don't go get screened or get vaccinated. So education is very important, as well as making sure that they are aware of the prevention and possible infection from the routes of like sharing needles and those things. So it's just making sure to remove some of the stigmatization, but also saying that it's very important that you are protected, because it's prevalence and many people can live with it for over 30 years without knowing. So yeah.
Absolutely. And I think that's important to, what you mentioned, like being a member of the community yourself as well. And that was definitely a theme we found throughout, was that often messengers are just as important as the messages themselves. And people in most of the focus groups we did responded pretty positively to vaccination overall. And one suggestion for framing it was as sort of 3 different security doors, and just kind of a way to, just protect yourself and your community. So, so the next question we have. Oh,
I have a point to say.
sure.
I wonder why the medical community, when you go for your checkup, general checkup, they do the blood work. I feel that they should include that hepatitis B blood work, because that's a way to identify if you have it or if you don't have it, don't you? So that if
Yeah.
you do have it, you take the necessary steps to do. And if
Yes,
you live with one or someone who has hepatitis B, then you have to get vaccinated. It should be part of the regular, don't you think? Part of the
Yeah.
regular program. Yeah.
Absolutely. Yeah. And I think that, so the CDC has
Yes.
recently recommended now to have everybody universally screened and
Yes.
vaccinated. But the next step is to make sure that actually happens, and
Yes.
also to make sure that insurance will pay for that as well. So those are kind of the next hurdles.
Yeah.
But yeah, absolutely. Everyone should be screened and vaccinated for sure. So the next audience question we have is, how best can we approach the barriers to dissemination of materials, specifically to ensure that grassroots communities receive the messages in resource-limited settings? So I'm not sure if anyone has a response for that, I'll open it up first, and then I can share as well if anyone has thoughts about that.
Can you repeat again the question?
Yes.
Yeah.
It is, how best can we approach barriers to getting the materials out to in resource limited settings to grassroots communities? So I think in different parts of the world. If anyone has thoughts.
Yeah. Can I go?
Of course,
Yeah,
yeah.
I think actually contacting like local newspapers in those grassroots communities would help a lot, because you know, the local communities and the grassroots communities do focus a lot on their local newspapers. And we could also engage and connect with the community leaders, such as elders or influential figures within the community, as well as collaborating with local partners who already do have connections with the local grassroots communities, like existing NGOs who have like expertise in working with these communities. I think these would all like help a lot with communicating and disseminating such materials.
Absolutely. Yes. Thank you so much for sharing that. I think that those are all really valuable paths forward. Definitely engaging leaders, both community and faith leaders, we found to be really crucial avenues, and definitely doing outreach in, local languages and in different contexts, I think is really important as well. So thank you so much. So we are running up on the top of the hour. We do just have one more question, which we'll see if we can, oh, actually, I'm sorry, it was actually the same question. So thank you so much. This has been such a great conversation. I really appreciate you all joining. And thank you so much to everyone in the audience. And I really appreciate you I'm sorry again about the poll not working, but a lot of you kind of by introducing yourselves shared what communities you were part of anyway. So that's really helpful for sure. And if there are any thoughts that you have about other avenues that you would like the materials to be created for, please feel free to let us know in the chat, or I'll also share our contact information at the end or as we wrap up. So yeah, thank you so much again. If Holly, do you mind just sharing the slides one more time, and we will just wrap up today. So we kind of already touched on this a little bit, but sort of the next steps that we're looking for are, we are planning to translate the materials for the 12 different communities. It may take some time, but we will be working on that as the next step, and we'll be exploring other areas to fill gaps in different requests that the communities had. So things like doing WhatsApp messages or radio ads or newspaper placements, things like that. So that will definitely be on the agenda as well. And we hope to provide sort of continued trainings and educations on these materials with community members as well. Next slide, please. So yeah, just a very heartfelt thank you to all of our panelists. Thank you so much for being here, and thank you to everyone for joining today. I hope that this was a good experience despite the technological glitch. And so we will be sending out a recording of this webinar when it concludes, and we encourage you, after the webinar ends, there'll be an evaluation form for you to complete. So we encourage you to do that, since your feedback is valuable. And again, I'll put the link to the materials in the chat one more time. But we encourage you to check these out, to make use of them and share them with your communities as much as possible. If you have any questions or would like to follow up, my email address is on the slide, and we'll also share that in the follow-up email as well. Here is, okay. And thank you so much again to everyone for joining, and to all of our panelists. We really appreciate having you here. And if there are any questions that were unanswered, you can feel free to reach out as well, and we'll get to those too. So thank you so much again, everyone, and have a wonderful rest of the day.
For having us.
Thank you.
Thank you.
Thank you so much.
Thank you. Bye.
Thank you. Thank you for the
Bye.
opportunity to do this. Thank you.
Thank you so much, Husky. Take care.
Yeah.
Bye.
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 Bye.